I'm Dr. Robert Metzger, and I'm a transplant nephrologist here at the Florida Hospital Transplant Institute. At this stage of my career, I'm focusing on organ donation, both living donor and deceased donor, trying to make the process as efficient and safe as possible for both the donor families, and the recipients. Most physicians have an early experience that leads them down a career path. Mine was in 1963 when I was a third-year medical student and assigned to follow a 16-year-old boy who had kidney failure from a devastating inflammatory disease we now call rapidly progressive glomerulonephritis. He was being stabilized on peritoneal dialysis, which was very primitive at that time, and we were hoping we could refer him to a Denver hospital where Dr. Tom Starzo was doing kidney transplants. Unfortunately, that didn't happen, and I sat with his parents one evening when the young man passed on. That experience made me want to get as much information as I could on the kidney and kidney diseases. And I got under the tutelage of the kidney specialist at our medical school, Dr. Dan Egan, and he arranged for further training for me. In 1969, when I finished that, I was called to active duty with the Air Force and assigned to a Wilford Hall Medical Center in San Antonio, Texas. Big Willie, as we called it, was also the kidney transplant center for the Air Force, and that got me even more involved in kidney transplantation. When I moved to Orlando in 1972, I joined with Dr. John Jablonski and his colleagues in starting the kidney transplant program here at Florida Hospital. I think the most enjoyable thing I've found in my career is when you take a patient who has end-stage renal disease or any end-stage organ disease and provide them a very successful transplant and see that impact it has on both the recipient, his family, and all those around him. That's an extremely enjoyable opportunity that I've had many times over. When I'm not working, my wife and I try to spend as much time as we can with our 6 children and 12 grandchildren. I usually bike about 7 miles, 5 or 6 mornings a week. We play golf a few times a month, and I'm an avid reader, both of the medical literature as well as non-medical literature, focusing primarily on World War II literature.